Americans are struggling with medical debt, roughly $88 billion worth. Last year, a U.S. district court reversed a Biden administration rule that would have removed medical debt from consumer reports. The rule was projected to increase credit scores for millions of Americans. That followed a 2023 move from credit bureaus to stop reporting medical debts under $500. The logic is elegant in its simplicity. Remove the red ink, and credit scores go up. Loans get approved, financial health improves, millions get a clean slate. It sounds like a rare win-win situation in public policy. But research from Gies Business economist Julia Fonseca and her co-authors suggests that it's not that simple. Erasing the debt report might not erase the problem. This is Research Reverb. I'm John Moist, and today on the show, is removing medical debt from credit reports just a placebo? For Fonseca, associate professor of finance at Gies Business, it all starts with the scale of the problem.
Medical debt affects a lot of people. So 1 in 7 Americans have medical debt, according to the census. So that's a lot of people. And when this medical debt goes unpaid, it often ends up in collections and it's then reported to credit bureaus. So those are the agencies that put together the consumer credit reports. And in 2021, there were $88 billion of medical debt in credit reports, according to the Consumer Financial Protection Bureau, or CFPB. So that's a large debt burden. But the second reason why we wanted to study this type of intervention is because it's happening. And we don't really know yet how these measures impact the people they're trying to help.
Fonseca and her colleagues realized that the deletion of medical debt data from credit reports created a perfect experiment. But before we get to the data, we need to answer a fundamental question. What makes medical debt different than other kinds of debt we might take on?
Right. It's different in a few ways. To start by stating the obvious, it comes from receiving medical care and not from buying goods and services or, from education. And one implication of that is that taking on this debt is often not an active decision, like applying for a credit card or going to college, but rather a consequence of a health event. Another difference is that there's a lot more dispute about the amounts that are owed in medical debt than for other debts. So as I mentioned, according to the Consumer Financial Protection Bureau, medical debt is often reported to credit bureaus with error. Right? There are billing disputes as well between the debtor, the healthcare provider, and the health insurer. So often these bills go into collections as the consumer is disputing how much they actually owe. And for those reasons, we think that having a medical debt in collections is maybe less informative about your ability or your willingness to repay your loans than if you have other types of debts in collections.
And if that medical debt is less informative, meaning that it doesn't really tell a lender much useful information about whether you're a risky borrower, then deleting it might not actually change how lenders treat borrowers. To test that, Fonseca and her co-authors used a statistical technique called regression discontinuity. That sounds complex, but the mechanism itself is pretty intuitive. It starts with that deletion of medical debts under $500 in 2023. That created a dividing line.
Now, our goal is to estimate the causal effect of deleting this information on people's access to credit and their financial health. And causal estimates are always a challenge, right? We certainly can't just, compare people with and without medical debt because these groups of people differ in many other ways that could also affect the outcomes that we're interested in. And we also don't want to compare everyone who had a medical debt deleted from their credit report with everyone who didn't. Because a person with a medical debt of, say, $100 may differ in a lot of ways from someone with a debt of $10,000. So what we do instead is something called regression discontinuity. This approach takes advantage of the fact that the intervention was implemented using a threshold. So if you had a medical debt with a balance of $499, it was deleted from your credit report. But if the balance was $500, it wasn't deleted. If whether your medical debt balance is $499 or $500, if that $1 difference is basically random, then we can estimate the causal effect of having this information deleted by comparing people who are right below the $500 threshold with those who are right above it. Because these people are going to be very similar in all other characteristics other than the fact that their medical debt information was removed.
Imagine two people. One owes $499 in medical debt. The other owes $500. Effectively, those two are in the same financial boat. But the first person gets their debt scrubbed while the other doesn't. If the policy works, that is, if erasing that item from a credit report matters, the first person's credit score should jump. They should have access to more credit, better rates, and more financial breathing room. But that's not what happened.
So our main finding is that there were no meaningful benefits of having this medical debt information deleted from your credit report. We find no evidence that removing this information about these debts affected credit scores, new loans, credit limits, repayment behavior, payday borrowing, or a lot of other related outcomes that we also look at. And for most outcomes, our estimates are really precise. And what that means is that we can rule out even small improvements. So for instance, we can rule out with 95% confidence that credit scores increased by more than 6 points. A 6-point change in your credit score is really small. It's less than 1% of the average credit score in our sample. So for most cases, we can rule out even small benefits.
That's a surprising finding. Debt vanished, but credit access didn't improve. It feels, frankly, a little counterintuitive. I wanted to know more. If lenders are in the business of mitigating risk, why wouldn't removing that debt have an impact? To find out, the researchers built their own credit scoring model using machine learning. Then they fed it the data to see if medical debt actually predicts whether someone will default on a loan.
This is pretty surprising if you think that lenders are using this information in their lending decisions. If lenders were using this information, we would expect these decisions to change when the information is no longer available. And that would change how much people borrow on average. So this leaves us with the hypothesis that maybe lenders aren't using this information when making lending decisions because it doesn't help predict future default. And remember, predicting future default is the main thing that lenders are using this type of information for. Now, the models that lenders use to predict default are all proprietary. So we can't just, inspect these models and see how much or whether they rely on information on medical debts. So what we do instead is build our own model and ask whether medical debt helps that model predict default. We use machine learning methods and we managed to build a model that performs really well compared to other academic work in this area. And we find that no, medical debts are not meaningfully predictive of default according to our model.
So lenders were actually ahead of the regulators. They'd already figured out that a $300 emergency room bill doesn't meaningfully predict whether you're going to default on your mortgage. For all intents and purposes, they were already ignoring that data. So when regulators and credit bureaus stepped in for a fix, they were turning down a signal that nobody was really listening to.
This is true both for medical debts below $500, but also for all medical debts in general. So this can explain why deleting small medical debts had no impact on credit outcomes, but it could also give us a glimpse into what might happen if the CFPB rule to delete the remaining medical debts ever goes into effect. We would expect to see something similar to when smaller medical debts were deleted, which is no meaningful changes in credit outcomes.
As it turns out, scrubbing the record of medical debt is a bit like a placebo. It looks like medicine, but it doesn't cure the underlying condition. The root problem isn't the credit report, it's the debt itself. And fixing that is a much bigger conversation than tweaking a report.
The main goal of the paper is to help inform this debate on how to best alleviate the burden of medical debt. And if you ask an economist about the best way to do that, the answer will probably be about expanding health insurance to reduce how much people are responsible for out of pocket after a health event. Now, that makes a lot of sense from a theoretical standpoint, but it's not easy to implement in practice. For instance, after several attempts at expanding coverage, 30 million Americans are still uninsured, and many people face substantial out-of-pocket costs. So it's understandable that policy efforts have shifted toward, these simpler solutions like forgiving medical debt, or in the setting that we study, erasing information about these debts. But what we find is that having this information erased provided no measurable benefits. So I think that tells us that, these efforts are perhaps not very fruitful. It's clearly a health policy problem, but people with medical debt do seem burdened by it financially as well. I think that addressing the health policy problem, so for instance, by expanding health insurance coverage, would help address the financial problem as well. But the main takeaway of our paper, I think, is that if we want to focus on the financial aspect of the medical debt issue, simply removing this information from consumer credit reports is not enough. It probably won't meaningfully improve people's financial health.
You can delete a line item, but it's a lot harder to solve a complex problem like medical debt and financial health. That was Associate Professor of Finance Julia Fonseca. The study, published as a working paper for the National Bureau of Economic Research, is titled The Effects of Deleting Medical Debt from Consumer Credit Reports. You can read more about research like this coming out of Gies Business at giesbusiness.illinois.edu. I'm John Moist. This is Research Reverb. Thanks for listening.